Hi. So today I'll be discussing my final project for a senior seminar, which is the PowerPoint on the research paper we completed. So for my topic, it was how exercise decreases cognitive declines in older adults with dementia. My name's Lucas Treese. My mentor was Dr. Veronica Ria. My major was biology, and today's date is December 10th, 2020. So the paper was completed in three parts: the introduction, the body, and the conclusion. The body was the bulk of the paper. We started off figuring out this paper by looking up a research question and producing a thesis off of that. So for me, I thought about it and I thought that as society increases in age, cognitive declines are going to start being seen at a more prevalent rate, which they already have been. And one of the most wondered things with this is how exercise can affect these cognitive declines. So, to begin the process, the research question that I studied was, how does exercise decrease cognitive declines in older adults with dementia? So, the thesis that was created was that people that participate in increased levels of exercise will experience less cognitive declines than their counterparts who don't, which just simply means that people who exercise more will experience less cognitive declines and potentially even less diagnosis of dementia than people that simply are sedentary or don't exercise very much. So, to start off, the paper was the introduction. So, in the introduction, I discussed what dementia was, what the cognitive domains are, who is affected by it, and what each type of cognitive domain there is. So, dementia is actually a disease that affects people of all races, genders, ages, and areas. No matter where you are in the world, you can be diagnosed with dementia. So, dementia is described as an impairment of an intellectual function that develop over time and affects one or more of someone's cognitive domains. The cognitive domains that are found in humans are complex attention, executive function, learning and memory, language, perceptual motor function, and social cognition. The domains are listed in the Diagnostic and Statistical Manual of Mental Disorders, which is one of the biggest research books in psychology. And in order to be diagnosed with dementia, a person must have an impairment of at least one of these domains. So, the types of dementia, which will be discussed a little bit later in this PowerPoint, are Alzheimer's, dementia with Lewy bodies, vascular dementia, frontotemporal dementia, and even mixed dementia. So now I'm going to discuss what the cognitive domains are and what part of the brain controls them. So complex attention is a person's ability to retain information and is controlled by the parietal lobe of the brain. Executive function, which is the ability to control other cognitive abilities and behaviors, is controlled by the prefrontal regions of the frontal lobe. Learning and memory relates to the ability of humans to learn new information and retain that information. This domain is controlled by the hippocampus and other structures in the temporal lobe. The domain of language refers to the ability to understand a language and to formulate complex sentences. This domain is controlled by the frontal, temporal, and parietal lobes of the brain, each responsible for a different activity. However, I will not be covering that because it doesn't get into exercise. Perceptual motor function is the ability of a person to connect their sensory skills to their motor skills. This action is controlled by the cerebellum, which makes sure the movement is exactly what it needs to be, and the frontal lobe, which is responsible for the movement being required. And social cognition is the last domain that is listed in regards to dementia, and this refers to how people see, store, and relate information based on interactions with people and situations. This process is controlled by the amygdala. So, next, after that, Alzheimer's. So the types of dementia was then talked about, which is some of the biggest part of the introduction. So Alzheimer's dementia is actually the most common form and occurs in 1 out of every 14 people over the age of 65. The less common types are known as dementia with Lewy bodies, vascular dementia, and frontotemporal. So Alzheimer's disease is actually the most common, like I said a couple seconds ago. And one of the reasons actually for that, it is tested and diagnosed for at a greater rate. Frontotemporal dementia and dementia with Lewy bodies are different than most of the other types of dementia because they have the symptoms diagnosed and not scans. So with dementia, one of the things is that people will have their brain scanned, and they'll see plaques and things built up, and that will show a for sure sign of dementia. However, in those two types of dementia, the symptoms do it. So they can have brain scans, but they can look fine. But as long as people have symptoms of it, they might be diagnosed with it. So dementia is actually seen in more older adults, and is seen in over 30% of people over the age of 80, which is insane. And it jumps up to about 50 or 60% for people over the age of 90. So next was the body of the paper. This talked about what the different types of treatments are, how exercise affects it, and it also talks about how exercise providers are not well enough equipped, and also it talks about how the caregivers need to participate in these exercise programs as well. So to start off, I talked about the different pharmacological and non-pharmacological treatments and how there's no official cure for it yet. However, the pharmacological treatments, which means you're using medicine for that, some of these include acetylcholinesterase inhibitors, mematine, antipsychotic medications, and atypical antipsychotic agents. The non-pharmacological treatments, the ones that don't use medicine, include exercise, diet, anything that is not involved in medical treatments, and they can actually be an advantage in hospital units and elderly care homes. After that, I talked about how exercise actually affects somebody and how it increases their activities of daily living and just their quality of life. So exercise increases people's gait and stability, strength, and will lessen the risk of falls for people with dementia. One of the biggest things in life for people with dementia is ability to live by themselves or an independent life. In order to do this, exercise may be used to promote this. And a study actually shows that the slightest amount of exercise that people participate in can delay the onset of dementia. This study was completed using a prospective cohort study that follows people over a long period of time, and this is beneficial because dementia is different from when you first get diagnosed with it to when you are in the late stages of it. So dementia is a very terrible disease and will actually cause people to lose control of their bodies and their muscles. And this is similar to a disease like muscular dystrophy where their muscles just stop working. So the muscles that aren't used or aren't used correctly will atrophy or die. And exercise is actually proven to prevent or fix these atrophied muscles. The use of exercise has actually also been studied in the treatment of frontotemporal dementia, and the blood flow to the brain allows the brain to recover from most issues, such as dementia or anything that the brain suffers from, such as strokes even. However, some people simply cannot be treated with exercise, just like some people cannot be treated with medicine for any type of disease or illness they have. One study shows that actually moderate to high intensity exercises don't slow cognitive declines, yet it does improve physical fitness, which can be taken with a grain of salt. However, it can be beneficial for people with dementia to have their physical fitness improve. When you're a child or a young adult or a young teenager, what you do can actually also delay your chances of being diagnosed with something like dementia. Playing sports and working out are positive things that can delay the onset, and being unhealthy, such as being obese and developing anything, smoking, drinking, can actually increase your risk of getting this disease. Exercise actually has a positive effect on diabetes because it regulates your blood sugar and checks your body. It can be applied that exercise affects dementia in a positive way as well. Diabetes is a comorbidity of dementia. It can actually cause dementia. So exercise affecting diabetes can actually also affect dementia. Hypertension has actually also been very highly associated with the onset of vascular dementia, just because they're both based from the heart. And post-stroke dementia, which is not very much talked about, is actually one of the biggest issues related to strokes. Many people suffer from post-stroke dementia due to lack of blood flow to the brain during a stroke. Like I said earlier, exercising when you're a child or adult can delay the onset of dementia because the person will receive proper blood flow to the brain to break up those plaques that may start to form. Dementia is actually also affected positively by exercise, and many doctors do recommend exercise as a treatment. Exercise must be used in all settings that deal with dementia, such as nursing homes, elderly care facilities, and hospitals. And people who are sedentary, which means they sit down a lot, have a higher risk of comorbidities and an even higher risk of dementia. Humans with dementia must focus on activities of daily living, or ADL. These activities are all affected by the onset of dementia, and people need to control these things if they want to have a good quality of life. People that have dementia that stay in hospitals do see a decrease in ADL scores, but exercise has shown to help these scores increase. Exercise providers that might be helping with these ADL scores uh, do not have the experience, the knowledge, or the supplies needed to work with these populations. So sometimes the dementia is not treated very well. There are other things that can delay dementia. One of these things is education. So a mixture of education and exercise can delay the onset of dementia the most out of anything else. One of the earliest things people can do and easiest things is simply just exercise. I'm not saying to exercise 7 days a week throughout your entire life, but just staying healthy in general can actually help with these cognitive declines. Exercise as well as education and keeping a person's brain stimulated will delay the onset and even prevent dementia actually. So it was found that nursing homes, just like hospitals that implement exercise programs to patients with dementia, have shown a better ADL score. There's actually a borderline significant correlation between dementia and exercise, and adults that live in homes must actually exercise. Nursing homes that so nursing homes deal with many different types of people. Dementia isn't a clear and cut disease; it affects everybody differently, so they have to adjust their treatments based on the person that they're dealing with. And any type of exercise that a person does will maybe not fix dementia, but it will definitely delay it or prevent it. So, dementia mostly affects the person's intellectual abilities and physical abilities. However, it does affect the people that take care of them by association. So, a caregiver will see these people all day, every day, and it will actually take a toll on their physical and mental health. So, by producing exercise classes that both include the patients with dementia and the caregivers, it'll allow for them to build a better relationship. It'll allow for the people with dementia to become healthier and even treated for that. And it'll also allow the caregivers to talk to other caregivers about what they need to do better for their clients. So the exercise classes are beneficial for both the person with dementia and their caregiver. So overall, dementia is this is the conclusion of the paper. Overall, dementia is one of the most pressing issues on our society and will continue to be as the society ages. So, the life expectancy now of the United States is about 78 years of age, and we just keep going up in life expectancy. So, the older we get, the more of a chance you have for dementia. So, we need to find a better way to treat or even cure dementia. There's currently no cure for dementia as of now. However, doctors and scientists have come up with a plan to treat it. And this plan will actually make a lot of people's lives easier with dementia. And living a sedentary lifestyle, which means, like I said, you're seated a lot more, has been proven to cause many issues such as diabetes, hypertension, depression, among many others. And if someone is going to be diagnosed with dementia, this doesn't mean that their life's going to be a struggle. People can do the correct things and they can actually alleviate some of the symptoms and live a fulfilling life. So, overall, after completing the research, there are just a few things that could potentially be researched more. One thing that I saw is just how much the exercise classes impact the caregivers. Another big thing is what type of exercise can positively impact dementia the most, whether it be cardio, stretching, lifting, or yoga, or a combination of all three of those things. Besides those two further topics, the research actually that has been made has been extensive, so not a lot of questions have been made from that. And then next are just my slide, are just my references, because not every single, I did not come up with most of this. So I hope you enjoyed my presentation.